Welcome to Mondays with the Midwives. I'm Kirsten Olson. I run group prenatal care at BCU Health, and I have for going on 9 years now, which is pretty crazy, but I really, really like it a whole lot. Some of the things we're trying to do with these webinars is just kind of like let you guys get a chance to know us and who we are and sort of answer some of your questions out there. That being said, if you want to type, if you have any questions that you have to ask while we're talking about group prenatal care tonight, just type them in the chat, and we will definitely get to them during the course of the webinar. But I want to introduce Megan Noonan, one of our fabulous midwives, one of five, and let her introduce herself a little bit. And Megan, if you could let us know where you went to midwifery school. I don't think you've ever, I know where you went, but I don't think you've ever said, this is where I went to school.
Oh, sure. Well, thanks for letting me be here with you. When I was a student at Frontier, which is a school based out of Kentucky, I actually had the opportunity to train with some of the midwives here at BCU, and also got a chance to meet Kirsten then and learn about group prenatal care, which was a really awesome opportunity because it's definitely not something that all midwifery students get to see, all midwives get to do, all providers get to be part of. So I think we're really lucky here. And I'm really excited to talk about it with you. We're just wrapping up my first group that everyone was due in May, and we'll kind of talk about how that comes about. But yeah, we're doing some fun things.
Yay. Well, thanks.
Yeah.
So I guess one of the things that probably when we introduce group prenatal care, especially when you talk to people about it in the clinic when they come in for their care, the main thing that people always have is well, what is it? What is group prenatal care? And the one misconception that a lot of people have is that it's a class. And so that's the main sort of thing we want to talk about. It's not a class, it actually is your medical visit. So they are 2 hours long, which a lot of people kind of go, ooh, 2 hour long appointments. But this is the part that's really good. There is no waiting room. You don't go to the waiting room at all. Your visit starts right when we say it starts. And we do 2 different times. We do a 9:30 to 11:30 a.m. or we do 1:30 to 3:30 p.m. And if we say your visit starts at 1:30, your visit starts at 1:30 and it ends at 3:30. The first half of the session is your health assessment. So we take your blood pressures, weights, we listen to the baby's heart tones, measure your belly. You have individual time, but kind of behind a little screen with the provider. So all that, all the parts of a prenatal care visit are actually taking place during group prenatal care. And then we just sort of allow for more time to talk. And we hit, don't you find this to be true, Megan? We hit the educational counseling pieces that are kind of par for the course with prenatal care. We talk about birth control, we talk about common discomforts, we talk about signs and symptoms of preterm labor, and what to do, who to call, what to look out for. But then we can kind of delve a little bit deeper. Wouldn't you say that we kind of, I guess what I'm asking you is then, because you do both, you do group prenatal care and you do the one-on-one, the traditional care visits. And we're both hitting on the same counseling pieces, but how does group kind of go at it differently from your point of view?
Yeah, I definitely agree. I think that all the things that you would normally talk to your provider, your doctor or midwife about in your visit are things that come up. And we usually with each group have kind of a theme for the visit where, sort of appropriate to what's going on in the pregnancy or how close we're getting to the birth. So maybe we talk about, maybe our theme is talking about breastfeeding, or our theme is talking about, common things that happen in pregnancy and what to do about them, like constipation, or some of the other fun, beautiful parts of pregnancy. But I think the difference with group prenatal care is you're not just there with you and a provider, you're there with other people who are also experiencing pregnancy and expecting a new baby. And so you're not just hearing about a textbook definition of what to do or why things are happening. You're also getting to hear about other people's experiences. And I think that, one thing we've definitely learned over the past year is how valuable social support is, and you know, how creative we've had to get to be able to have that in our lives. And group care has always provided that social support that I think is so important. You may be someone who is pregnant and 10 of your friends are also pregnant. And so you can talk about what's going on with you. They can talk about what's going on with them, and you just feel a little less alone. But a lot of people don't have that. Maybe all their friends had babies like 10 years ago, or they're the first person in their friend group, or they're new to Richmond and they don't know anybody yet. And I think having a way to sort of tap into that experience with other people and other families is just so powerful.
Yeah, I would definitely agree. I think that is the big difference, right? Is that because I feel like pregnancy in and of itself and parenting, especially in those early days, it can feel so isolating and overwhelming, and even if you do have like a really good relationship with your provider, you're only seeing them, once a month, once every twice a month, as you get further into the pregnancy. But those visits are like 15 minutes long, 20 minutes long. And yeah, they're just, it's like you need more, but you don't know you need more until you get it. Like I've heard that from a lot of people who do group prenatal care. They're like, I had no idea that I needed this until I got it. Like I had no idea how overwhelmed I was. And so you do get a chance to kind of center yourself a little bit in the group. We always do. We always try to, and this was when we pivoted everything to virtual stuff, and we were doing telehealth. We did it in a group in the Zoom. And then, opening back up, coming back in to be able to meet face to face. We always try to include a mindfulness activity, some sort of and I think more than ever this year with anxieties being so high, that was like a forefront for us, was like, we've got to do like anxiety reducing meditations during the sessions. They're so important, I think, to sort of calming yourself down a little bit. So I think I'm trying to think of some of the other questions that we often get. Oh, I also get, is it an extra cost for this? Like, do I have, how much does it cost? Because it is your prenatal care, it is billed under your insurance. Like, we schedule it in the system as a return OB visit. We arrive you in the system. Your providers document on that on your electronic medical record system that you attended the group visit and what we talked about and what was going on, like what your blood pressure was, all that stuff. So there's no extra cost to you. Like, it is just one of those services that we provide at VCU. It's just an enhanced version of prenatal care that we offer at VCU.
Can you talk about a little bit more about some of the nitty gritty logistics, like where is it held, and when does it start? Do you have to start your pregnancy knowing that you want to do group care, or can you join anytime? Like, what does all that look like?
That's a good question. Yeah, the logistics of it. So we offer it at our Nelson Clinic downtown on the 5th floor. We have a dedicated space on the 5th floor. And then we also offer it at Stony Point 9109, not 9105, which is where you would go for your prenatal care. But we use the conference room over at 9109, and we kind of transform it into this clinical space where we have the assessment table, and then we have like this screen to kind of give you that a little bit of privacy there. And we schedule the groups based off of your due date. So if, like Megan and I, if you come in for your new OB, if you come in for like your 12 weeks and you get scanned and it's like, oh, your LMP, like your last menstrual period, that you're going to be due in May of 2021. Then we reach out to you and say, here are all the dates for the May due date group. And this is a kind of a cool thing. So you would start probably going right into your second trimester, like around 15 weeks pregnant is when you would start. Another kind of great thing about group prenatal care is that your entire schedule, like, especially if you're trying to do childcare and schedule around your job, here is like the entire list of like 10 prenatal care visits. And then you might have to have other visits scheduled in between there, which I can totally take care of it for you. Just let me know and we'll hook you up. Don't worry about it. It's like concierge level. Yeah, you kind of can sort of plot out the next couple of like months going forward up until you're about 34 weeks. And then about 34 weeks, you then go back into one-on-one care because you're going every week. Starting at like 36 weeks, you're going every week until you have a baby. So it carries you through the majority of your pregnancy, and it is all scheduled out. And to that end too, like when you have to do any kind of lab work, like the everybody hates the sugar drink. I never understand why, because I never minded the sugar drink. Like maybe I have like a super duper sweet tooth, but it never bothered me. And everybody's like, oh, this is gonna be the worst. I'm like, girl, drink it.
Like, get me another one.
I know. I'm like, it's like it's Sprite, like it's flat Sprite. It reminds me of like, yeah, being a kid or whatever, So I never thought it was that bad, but we do all that in the group. So the whole point too of group prenatal care is to try to streamline everything for you as much as possible. We know it's overwhelming. We know like the anxieties it can produce. So our goal is to logistically make that as cumberless as possible, like, so that you can, you drink the drink in group, an hour later, you're done. We leave, you go get your blood drawn down at the lab. If you have to have a vaccine, if you want a Tdap vaccine, not COVID vaccine, sorry, we can't do those in group. But the Tdap vaccine, we can do that in group as well. So we try to streamline it as much as possible for you so that you're not having to do extra stuff.
And what about if your schedule changes? So like you have all your stuff scheduled out and it's great and you're going and you're loving it, and then something comes up, your job can't let you off and you have to miss a group. What can you do?
That's really fine. Like that's another thing too. I think when I first started at VCU, it was a lot more like hard nosed, like, you have to be here for everyone. And you can only bring this one pre-approved support person. And it was very hard nosed. And I was like, wait a minute, aren't we all adults? Like, don't we all have grown-up lives? Like, I think we can be a little more flexible in that. So just let me know, just let me, or if you're in a group with me and Megan, let Megan know, like through the portal, or just text me on, like, I have my little Centering Pregnancy VCU Health phone. You can just text me and say, oh, I'm not gonna be able to make it next week. And then I just cancel that appointment. And then as long as you have an appointment, like with another provider, with a nurse practitioner, with a midwife, with an OB, as long as you're covered, I'm fine. Like I am not like some sort of fourth grade teacher keeping attendance, So yeah, it's easy. You're not.
And then that kind of, I think, introduces another question. If you come to VCU because you want to see a midwife, or there's a certain doctor that you really want to have be part of your care, can you also do group? How does that work? Like, is it one or the other, or is it only with the midwives that do the group?
Yeah, so I kind of try to work with people because I get it. Like I understand, like let's say we have a group, let's say you want to work with the midwives. And then we have a group that's your due date, but it's led by an obstetrician and you're like, kind of bummed out about that. Well, and I've done this, like, well, if you want to do the group after, like you might be a little early, but you can do like the, instead of doing the September due date group, you can do the October due date group with a midwife. You might be a little earlier than everybody else in the group, but if you're okay with that, I'm fine with that too, So we've done that before. And then too, we've had women who do high risk clinic. They might be having like high risk pregnancies, like twin births or something like that. And that's more of a commitment from the pregnant person themselves. Like if they would like to be followed by MFM or by their provider and also do group in conjunction, there's no problem with that. You're not going to get penalized through your insurance or anything like that because it's a global fee. So it's not going to cost you anymore. That's more of a commitment on your end. I'm very upfront with people. I'm like, anybody would love to have you. The MFMs would love to have you. The midwives would love to have you. We'd love to have you in group. And if you can do all those, that's great. But that's a big commitment on your end. So think about that. Cause I'm not some sort of like salesperson trying to like get you to buy like this flashy ring of group prenatal care. Like it's your care, and how is this going to fit into your life? If it's going to cause you more stress because you've overcommitted yourself, don't do that, especially if it's a high, like you probably need to be managed. You not probably, you need to be managed in a high risk clinic with an MFM. And so maybe, I mean, I've offered this to some people too, like just come in. We do like this tour of labor and delivery, like a virtual tour. I'll just schedule you for that. And you can just jump on and do those kinds of things if you want. Like I said, I'm pretty flexible, and I think we've had to be more flexible during this COVID time, and we're pivoting back and forth, and everybody's feeling a little. I'm like, whatever's going to work best for everybody, that's what we're going to do. So, yeah.
Yeah, I think that definitely is like a good way to sum it up. Like we're really flexible. We want it to work for people if it's something that they're really interested in. I think also touching on the individual provider, a lot of people are really, really excited about group care, but if they are scheduled with like a nurse practitioner or an obstetrician for their group month, you still are going to have some visits at the beginning before group starts, and you're going to have some visits, a lot of visits probably still at least a good couple of weeks at the end. So
Yeah.
you will have an opportunity to work with whichever provider one-on-one, whether it's a specific obstetrician or the midwives or a nurse practitioner. So you'll have an opportunity to meet whichever provider group you want taking care of you in labor, even if it's not the one who's running the group that you're a part of.
Facilitating the group. Yeah. Thank you for summing that up. So that is true. And I know that with you guys, with the midwives, this was something I think that Melanie Hartman, who's another one of our fabulous midwives, this was a couple years ago, actually. She was like, do you think we could start because it was usually like that, you would do group up until you got to that 36 weeks, and sometimes it kind of ran into 37 weeks. And then you would start seeing the midwives individually or whatever. And Melanie was like, can we kind of start having that, if you're with the midwifery practice and you're doing group prenatal care, can we start seeing them at 34 weeks? So just to absolutely make sure that you, as the pregnant person, and the midwives too, because I know you guys actually want to lay eyes and talk to and kind of get people's a read on people's mojo of where they are in their head and in their bodies. So we started doing that too, is kind of making sure that the groups end a little bit sooner. So let's say if it's an October due date group, the group is going to end maybe the last part of August. The very latest would be the first week of September, to make sure that you have enough one-on-one visits with the provider team that you're going to deliver with, be that physicians or midwives. So that was a Hartman strategy.
Well, we should probably wrap up our discussion just in case anyone has any questions. But one other thing that I wanted you to talk a little bit about is after the baby's born. What does that look like? I think that's also kind of a special part of group.
Yes. So we do. And we now have this new, we're doing a new version of group prenatal care. We used to do this thing called centering pregnancy, which is this trademark model. And now we're doing pregnancy and parenting partners. And it's more focused on the social determinants of health, but it also has a little bit more of that emphasis on the social supports too. So before we would do this one group where we would just do a postpartum reunion group. It was just one session, and it's awesome. It was even better when we could all be in person. But we do it via Zoom, because little newborn babies are not coming into the hospital. Their little immune systems, we need to keep them safe. But it's really fun. And basically you just come and you tell your birth story, whatever you feel comfortable sharing. I think that's another thing too, just kind of talking about group. A lot of people get a little I don't like sharing in group spaces or whatever. Nobody's going to force you to share what you don't want to share. And we've had some people join group and they maybe spoke 3 times their entire time that they were, in group prenatal care the whole time. That's okay. They're legitimate participants in the group, right? Their energy is there. So yeah, it's really fun. We tell the birth stories, and then we talk about how is breastfeeding going, because breastfeeding is like 99% of the time breastfeeding is not going as well as you want it to. Like, and that could be that you're experiencing difficulties and you had to get like a latch and you've had consultants coming in to help you, or it could just be something where you're like, OMG, I had no idea that babies don't sleep and all they do is nurse. You're like, really? We told you. I know we told you that, you know? So we also talk about, and then we also talk about like visit, like what kind of like birth control you want. But now with the social piece of it, we do another, like we do the postpartum reunion, and then we do 2 weeks later, just a postpartum check-in. Okay, how are you doing emotionally and everything? And then we also do a social check-in in pregnancy as well, that I think is really awesome. I see we have a question that came up. What about support for partners, especially after birth? I guess, well, partners are included in this. That's a good question. Like we do absolutely welcome partner participation in the prenatal care process. And then they're there too, as far as the postpartum reunions. As far as, maybe Megan, you can talk about this, but because, and this comes up a lot too, like, oh, if I'm getting the tetanus, diphtheria, and pertussis vaccine and the flu vaccine, can my partner get one as well? And we're like, your partner's not our patient. So technically we can't, not even technically, like we can't. We cannot give him or
but we
her
can talk
medicine.
about ways that partners can obtain anything that might be recommended
Right.
for having a new baby, like the Tdap vaccine, like a flu shot. Sometimes there's, different genetic testing that's recommended for partners to have, depending on people's specific risk factors. So we kind of can talk about that. But in terms of actually, providing any sort of like hands-on medical needs of the partner, we wouldn't be able to do that.
Yeah.
But that's true of group or individual care.
Right. Yeah. And that's, I think, yeah. So I think that's the thing, support for partners, especially after birth. There, we could actually, the same thing, there's also tons of recommendations that we can make out in the community that you can avail yourself of. And we do know all that stuff and we'll absolutely support you in that way. And then, do all hospitals in Richmond offer group prenatal care? A good question. No, none of the hospitals offer any form of group prenatal. We are the only ones. VCU Health is the only healthcare system that offers group prenatal care.
That felt like a trick question.
I know there are others that are further west of us, just up in the mountains a wee bit. That are they're trying to get it up off of the ground, but they, I think COVID kind of threw them for a loop as well. But no, we're the only ones. We've been doing it since 2005. It started off as like a pilot project that actually one of the midwives started. She doesn't work here anymore. And it's just kind of grown from there. And yeah, we're the only hospital system that offers it. So, and we do actually get people calling who are interested in group prenatal care. And they're like, oh, do you have to be a VCU Health patient? I'm like, yeah. And they're like, oh. Like, just come.
We're very flexible, but that is a requirement.
Exactly. Just come and be a VCU Health patient. We got you.
Let's see. Do we have any other questions? And then maybe we can just kind of wrap up with some final thoughts or things that we love about it.
Yeah, well, there was one question I know I had written for you. Hold on a second. Well, I think you kind of already talked about it, but I wanted to kind of hear it from maybe more from your perspective. Is it, do you enjoy it? Like the sort of the time, like knowing that the appointments are 2 hours, like you have 2 hours to spend with, 6 to 8 pregnant people all at the same time. Is that somehow kind of like calming for you? Like as far as like talking with them or getting to know them in any way, shape or form versus in the clinic? I've always kind of been curious about that.
Yeah, I mean, I think they're just different. I probably wouldn't want to do only one or the other because I think you get different things, but it is really nice getting to see people interact together and getting to interact with them and just hear about like a lot of different experiences because we do have people from a lot of different backgrounds. We have people who've had children already. We have lots of new parents. We have, people who are working, we have people who are staying home with their kids. So it's just kind of approaching things from so many different angles and really coming together. And I think, parenthood right now, there's a lot that people are divided on, but having an opportunity to see in a really nice small group setting, seeing people come together and support each other, I think is just a really nice thing that on a bigger level, even beyond being a midwife, it's just nice as a human to see that.
Yeah, I agree. Like I can tell you after I do group, I'm just in I'm in an elevated mood at when I get done with doing a group, like, because there's something about that, the camaraderie that comes out of it. And like you mentioning too, like, people who have had babies before, like this isn't their first time at the rodeo kind of thing. It's so awesome when they're in the mix with first time moms or first time parents, because first time you're so just like kind of freaked out and everything seems like so overwhelming, and then you've got these like second time, third time parents who are just like, okay, like boots on the ground, here's how it's going to go, like you don't need to worry about this, these, and I love that, because then I'm kind of like, oh, I just get to sit back and like these people literally know more about like all these breastfeeding accoutrement than I'm like, yes, tell us how that worked out for you at 3 a.m. Like, and it's just I think it just kind of puts everything into perspective especially for first time parents, when it can just seem so like, I'm never going to be good at this. And then a second time parent, like, oh yeah, there's going to be days when you're going to be like awesome at it. Like, oh my gosh, I am just firing on all cylinders. And there are going to be other days where you're terrible, and it's okay. It's okay. Like kind of like forgive, be gentle with yourself, and like getting that information from parents, not from providers. It just seems like it's received differently when it's like done, when it's shared like that, I think. And it's kind of nice to bear witness to that, I think.
Yeah. Well, I don't think we've got any more questions. So do you want to just end with how to go about signing up, or how to go about getting an appointment?
Oh, yeah. The best way to sign up is, I always tell people, ask for it by name. When you go in and see your provider, let them say, hey, I'm interested in group prenatal care. Like, how can I get signed up? And you'll receive a text message. Like your provider will send a message to me through the medical record system. I will reach out to you via text, like to schedule a time to talk to you, or we can stay on text, whatever you're more comfortable with. And then you let me know if it works for you, and I get you scheduled, and then we go from there. Like, it's pretty easy.
Perfect.
Yeah. Well,
all right.
Thank you everybody for joining us tonight. This is our final Mondays with the Midwives until we go on to our summer hiatus. Yeah. I don't know. I'm like, where's my summer hiatus spot? Megan, where are you going this summer? Are you doing anything?
Well, we might go to Maine for a little hiking trip.
Okay. That's nice.
Yeah.
I know I'm going to Johnson City, Tennessee, because my sister lives there. I've never been to Tennessee. So anyway, yeah, that's what I'm doing on my summer hiatus. That's what Megan and I are doing on our summer hiatus. And we'll see you all hopefully in the fall for more of our Mondays with the Midwives. Thank you so much, everybody. Perfect. And have a great evening. Bye, Megan.
Bye.